Good morning to all. My topic is autologous platelet-rich plasma, effect on corneal epithelial defect in post-infectious corneal ulcers.
Sir, sorry to interrupt you, sir. Kindly make it full screen, sir. Yeah, thank you.
The multi-layered corneal structure acts as a protective barrier to infectious agents via tight junctions between neighboring cells. The shear film composed of lipid, aqueous, and mucin layers also helps maintain corneal transparency and smoothness. Ocular surface disorders caused by infection, inflammation, and injury may cause a delay in wound healing of the corneal tissue, ultimately resulting in visual disturbance and persistent pain. To activate the rapid regeneration of corneal tissue, several growth factors EGF, NGF, and FGF are used as topicity. PRP contains concentrated platelets can be obtained by centrifugation from whole blood mixed with an anticoagulant. Platelets release variety of cytokines and growth factors. With these epitheliotropic factors facilitates the proliferation, migration, and differentiation of the ocular surface epithelium. On the basis of these properties, serum eye drops has been effectively applied for the treatment of ocular surface diseases, sanguine dry, ocular graft-versus-host disease, persistent epithelial defect, neurotrophic keratopathy, and recurrent corneal erosion. As these derivatives can be obtained from patient's own peripheral blood, there are few side effects and emulation. Material methods related to the clinical records of 15 AIOCs of 15 patients with epithelial defect of post-infectious corneal ulcer. The patients were prior treated at some other center with proper antibacterial and antifungal medication with no signs, symptoms, and findings of active infection. But the epithelial defects were persisted even after 30 days or more of the end of the treatment. The patients attended OPD for complaints like ocular watering, irritation, and pain, as persistent epithelial defect under slit lamp after staining with fluorescent strip under cobalt blue filter. Corneal epithelial defect was examined for dimensions under slit lamp after fluorescent staining using cobalt blue filter by making horizontal and vertical slits and taking measurements from scale on the top of the slit lamp by adjusting height of the slit. Total 15 as of 15 patients, mean age 63, ranging 55 to 68 years, 12 male, 3 female were included in the study who visited the OPD between April 19 to March 20 with corneal epithelial defect were treated with autologous PRP. 6 patients were treated for fungal corneal ulcer and 9 patients for bacterial ulcer. Exclusion criteria: patient who had significant systemic illness like thyroid, diabetes, any leadless abnormalities, cerebral palsy, and were excluded from the study. 20 ml of blood was used and mixed with 20 ml of anticoagulant citrate dextrose solution and centrifuged at 1,400 rpm at 8 minutes and then 2,400 rpm for 4 minutes. The upper most layer and buffy coat was separated in a sterile manner and transferred to empty vial of artificial air. Patients were explained to store these bottles at minus 15 to minus 18 degrees centigrade in freezer and shift to lower compartment of refrigerator 30 minutes before use at 4 degrees centigrade. A vial of drop was advised to be discarded in 5 days and to visit to hospital for PRP extraction and use while dispensing and to visit soon if found any complaints in eyes like redness, pain, or distress to roll out any contaminant in the vial. Frequency of installation was explained to be 6 times a day and asked to review initially every alternate day and then every 3 days and then every 5 days, and those was reduced as per response to QID and DID. So this is a table of patients with age, then their horizontal epithelial defect, vertical epithelial defect, and time taken. Out of 15 patients, 14 patients achieved almost complete revitalization except one, aging 67 years. Due to poor compliance and hygiene, who landed up into infectious ulcer again, and symptoms and signs of inflammation was started with injectables and eye drops. So the average horizontal diameter of corneal epithelial defect after fluorescent staining on cobalt blue filter of slit lamp was 6.25 mm, ranging 4.5 to 8 mm. Vertical dimension was 10.2 mm. Average ranging 5.4 to 9 mm. The patients before PRP average time taken to heal the epithelial defect after PRP therapy was 15 days, ranging 8 to 22 days. Our study demonstrated that administration of autologous PRP eye drops significantly enhanced the epithelialization in patients with post-infectious corneal ulcer. Since the preservative-free PRP eye drops are prone to contamination, there has been always a concern about the risk of superimposed infection. However, only one case in our series developed ocular infection during the treatment with autologous PRP eye drops.
Just 1 second.
In the light of the growing interest in blood-derived products and the lack of effective treatment for non-healing corneal epithelial defect, platelet plasma seems very promising. It is an autologous product without any preservative, extremely abundant in platelets. It has been proved that platelet-rich plasma, it contains cytokines, growth factors such as PDGF, TGF, beta-1, beta-2, IGF, EGF, EGF, FGF, and IGF. All these mediators set off the process of cell differentiation, proliferation, and migration, angiogenesis, and process of regeneration of the damaged tissue. PRP is known to be conclusion is PRP is known to be an effective modality for corneal epithelial defect treatment with least side effects.
Good morning, Raj.
These are some pictures and references. Thank you.
Yes, ma'am. Should I start from here? Okay. The topic of my study is neuro-ophthalmic manifestation in patients with HIV/AIDS. So we concluded that the spectrum of neuro-ophthalmic
Dr. Vaibhav, sir, some background noise is coming from your end, so make sure his.
Thank you, Dr. Vaibhav, for presenting. Uh, uh, so my question is, Dr. Vaibhav.
Yeah, unmute your mic, Dr. Vaibhav. Yeah, good.
Yes.
So from where you were collecting this blood? From the blood bank or?
No, ma'am, from the patient. The patient, they used to come in our OPD, and when we used to diagnose them as persistent epiphytic defect, we used to collect the sample from their anti-incubator backup.
And these patients which you have treated, it was like that patients you have labeled as a PED or immediately after the this treatment of ulcer?
Ma'am, we label them as PD because after the completion of treatment, uh, 1 month has been already passed.
Okay.
So
So
they were.
you have not tried the other modalities which are available, those like TASO-FE and all?
No, ma'am.
Okay. Thank you.
I just want to ask you,
Yes.
you prepare once only this autologous serum, and do you keep in a separate bottles like 5, 6, 7, 8, so contamination can be avoided? Because
No,
if
sir.
you are using only one bottle and always you are using that and keeping in the freeze.
No, sir. Every time a different CMC eye drop which was available in our government hospital setup, we used to inject in that and we used to give to the patient. And the maximum limit of the days, 5 days, we used to keep. The patient used to keep it for maximum 5 days, and then he was supposed to discard that, and we need to prepare one more.
Every 5 days you prick the patient then?
Yes, sir.
Thank you.